Are you someone that likes getting pumped? Or are you someone that sucks at climbing when you get pumped? If so, blood flow restriction training to get pumped, and training to do work on your fingers while you're pumped is probably a great intervention for you. This video is going to be a demonstration of how you would use blood flow restriction training to train your fingers at a reduced intensity. The hallmark of blood flow restriction training is creating metabolic stress at the muscle that's being used to be functional with less oxygen. In that context, without oxygen availability, we start using the anaerobic muscle fibers, which coincidentally are the large muscle fibers. So there's a lot of good science to support that blood flow restriction training actually improves maximum strength and improves recruitment, similar to high intensity training. Just like any training intervention though, it's never going to be a full replacement. We're never going to optimize, or we're never going to continue to optimize our performance by choosing one only training intervention. But there's always a location in a training cycle, whether it's in season, right before the season, or during an off-season phase, where we would want to reduce the load to our tendons and do so at a lower intensity. Most of the literature has been done on maximum intensities of 20 to 50%. So we can reduce the intensity of an exercise and we can really maximize the benefits to the muscle as well as to the vascular system. If you're trying to calculate someone's 1 repetition max and the loads that you would use, you can do so with a strain gauge, measuring them pulling on the same exact edge size that you would test on. I usually use a 20 millimeter edge. Or the other thing you could do is you could simply add weight to their body until they're getting to their maximum for approximately 3 to 5 seconds. To use a really easy example of the prescribed intensity of blood flow restriction training, if you have an athlete with a strength to weight ratio of 2.0 on a 20 millimeter edge, that means they can hang or pull twice their body weight, which means their body weight on a fingerboard is 50% of their 1 repetition maximum. That's the type of intensity reduction that we can use with blood flow restriction training, but still see maximal strength gains. For athletes that don't have fingers that are that strong and they're going to be using less than their body weight, you could use the pulley system, but you could also have them stand on the ground and just lean into the board with their finger flexors. The other option you could do is use a campus board where they could put their feet on the wall in front of them, hanging on their fingers. In those contexts, we beg the question as to whether they should or necessarily need to be training their finger flexors in isolation aside from just climbing. What I'm going to demonstrate for you today is how I perform blood flow restriction training for the finger flexors on a simple tool like the fingerboard. First of all, I'm going to put these bands on. I'm not going to necessarily inflate them and do the whole protocol for you, but we're going to talk you through it. So I'm going to put these bands on my arm. The only location in which I would put these bands would be below my deltoid muscle and above my bicep muscle. We do not put them on the bicep muscle, or we do not put them on the elbow. And then I would do so on the other side. We're going to cinch these up and pull them over the top. And then you would pump them up with air. And specifically, you would want to use a product that has a pneumatic measuring device so you can document how much pressure you're actually putting into the band. The one thing you want to remember, the product that you use has a very specific pressure that goes to that product. So for this particular product, the Be Strong product that I use, it is not the same as if it was going to be a blood pressure cuff, or it would not be the same pressure as if it was going to be another blood flow restriction product. So make sure you take that into consideration. The importance of having a measuring tool though is so you can increase the intensity as well as you can moderate it to make sure that you're staying within a safe range. I would put this on, I would pump these up to the specific pressure. In my instance, I would probably pump this product up to 200 millimeters or 250 millimeters of mercury, and then I would start doing my exercise intervention. Note as well though, before I start this, I probably would have done some sort of finger warm-up. I would have done some isometrics on the bar or some pull-up exercise, climbed on the wall for a couple minutes, done some regular fingerboard training just to warm up my finger flexors. For this example, for the finger flexors, the goal is to fatigue the finger flexors in a more general way, which we will use on the fingerboard, on a flashboard, doing finger curls to fatigue. And as soon as my finger flexors are fatigued and they're pumped and my muscles are failing is when I'm going to get on the hangboard and hang until failure as well. The reason that I want to go to failure with these exercises is because I want to use the small muscle fibers for the general exercise, which is the finger curls, Then I want to use the big muscle fibers for the finger hangs on the finger. So all I have as a setup is a flashboard from tension climbing. I have a loading pin, and then I have some weight on the bottom of it. When I did some research in my office with this particular protocol, most of the males are using about 45 to 65 pounds with both hands doing finger curls. Most of the females were doing 30 to 50 pounds. So depending on you individually, it kind of depends on how strong you are. But the goal with the pre-fatigue exercise is all about, like I said, going to fatigue. So we would choose an exercise intensity with the weight where we would stand vertical and these bands are inflated, and then I'm going to start doing curls. This, as my example, is only 10 pounds, so I'm not going to get very pumped, but we should try and aim for approximately 15 to 30 repetitions. The first set, and the second set, you might be able to get to 30 repetitions, but the subsequent sets, you should not be able to get that far, and we should be going to muscular failure. So I would curl. The faster you go in terms of the tempo, the harder it's going to be, the more energy you're going to use, the faster you're going to get pumped. Let's say I would get to 29, 30 there. I will set this down, and then I will immediately go to the fingerboard. I will choose the position that I'm targeting, and I will hang to failure. So in this case, for my study, we did 7 seconds. However, since then, I've had people hang on as long as they can. So sometimes people would go 15 seconds, sometimes people will go 20 seconds. The general prescription is choose the edge size that's the smallest that you can hang on to for at least 7 to 10 seconds. And if you can hang on for a longer period of time, then you can reduce the edge size. So you would do a reduction in edge size if you're trying to get maximum strength, and you would do an increased edge size for a longer duration of the hang if you were looking for overall pump tolerance and capacity. So after you would do the hang portion, you would rest for 30 seconds. So during your 30-second rest, there's no muscle contraction, so there's no blood actually leaving the forearm. When we're doing the finger curls and when we're doing the hang, there's a little bit of blood moving past the band and past the valves in your veins. During the rest period, the band is restricting the blood from leaving your arm. You get all that blood that accumulates, lactate, hydrogen ions, inorganic phosphate, carbon dioxide. All of those molecules send a signal to your brain, which gets a huge hormone release as if the intensity of that exercise was really high. This is how we utilize blood flow restriction training to really maximize strength in the muscles that we're targeting with the exercise. One of the other things that blood flow restriction training has been demonstrated to improve is the vascularity in the working tissue. So if we create hypoxia in working tissue for an extended period of time over a series of sessions, over a series of weeks, we improve the capillary density and we improve the health of the endothelium, which is the inner lining of your blood vessel walls. You're going to do that for about 12 to 15 minutes. I chose 12 to 15 minutes when I did my research because after 15 minutes, people were really sick of doing it. The one thing about blood flow restriction training is it's not comfortable, and there's no real good way around that. So if it's not something that you enjoy, if you don't enjoy that pumping sensation, this is probably not the best intervention for you. After the 15 minutes, I usually have participants leave these on their arms for another 5 minutes. So the first set's usually okay, the second set is usually okay, the third set's usually really awful, and the third through the seventh set are really quite painful. That's totally normal with blood flow restriction training. Most of the literature would say 7 out of 10 level of discomfort is totally normal. That's kind of what we're targeting. If you get some discoloration in your arms, that's also very normal. And that depends on the pigment of your skin as an individual and the capillarity inside your forearm muscles. If you get a little tingling in your fingers at the first set or two, that's okay as well. That should go away. So the one thing about blood flow restriction training is it looks scary if you're watching someone else do it, and it feels scary if you're a person doing it for the very first time. This is why we teach certification courses on the topic. So if that's something you're interested in, make sure you send me a message. We can set one up at your local gym or your local physio clinic or chiro clinic, and then get you trained up on how to use this. There's also lots of good research on the topic. If you search PubMed, look at some systematic reviews to learn more about this particular intervention. I've done a number of podcasts on the topic, both with Training Beta and with Eric Hurst. So go ahead and check those out if you're looking for more additional information on blood flow restriction training, or go ahead and send me a message below if you have any questions.